Welcome to Tuesday's edition of COVID-19. The pandemic is said to be creating the perfect storm for many forms of addiction related to alcohol, to drugs and to smartphones. Now, we have more on this later on the programme after a look at the pandemic updates with our Kwon So-ah. Now, So-ah, here authorities here in the country have recorded a rise in the daily tally.
Unfortunately so, Sunny, and it is in fact the highest number we're seeing for a Tuesday, with almost 1,600 cases tallied as of 12 a.m. and that is a rise in both domestic and imported infections. Now, if we take a look at our graph, it is a rise by 222 infections compared to yesterday, and also compared to last Tuesday, it's an increase by 227 cases. With that, Korea has accumulated 263,374 COVID-19 infections, and the death toll stands at 2,330 with 3 additional fatalities. Now, here in the capital, Seoul, we have been seeing a rise, but also especially in Gyeonggi-do province this Tuesday, which has a similar caseload as Seoul, and also the Jeollabuk-do province as well as Jeollanam-do province have seen increases up to 30 and 35 cases respectively. Those places had single digits just a day ago. We also have some positive developments, though. On Monday, the country broke a record high in daily COVID-19 inoculations, with 1.37 million doses having been administered. So let's take a closer look. That's almost 60% of people that now have received at least one shot. That's 30.7 million people, and also 18.3 million, or 35.8% of the nation's population, has been fully vaccinated now.
Right, so and against that backdrop, I understand the concept of learning to live with COVID-19 has been reiterated here in the local front again.
Right, Sunny. So officials have been frequently mentioning that suggestion. And on Monday, President Moon Jae-in has also hinted that the country will be able to move towards a gradual shift to a new COVID-19 containment strategy with minimal disruptions to our daily lives. And on Tuesday, the Health Ministry has released results of a public survey which showed 7 out of 10 people are in favor of such a transition. In regards to the timing, more than half of the respondents said it should take place when at least 70% of the nation's population has been fully vaccinated, so around late November. Some 42% believe that daily infections must be kept below 100. More than 28% said below 500, and 15% below 1,000. Vaccination and infection figures, though, are not the only factors to consider.
The important factors of consideration are the fluctuating number of seriously or critically ill patients who need to be in intensive care units and the fatality rate. This will be reviewed and weighed into our prevention measures.
Let's also take a look at the global situation regarding the COVID-19 virus. We're seeing that the UK here has become the 5th country around the world that has surpassed the 7 million mark when it comes to total infections. And for now, we've got 9 countries that have at least 5 million cases and 20 countries with over 2 million total infections. And in the past 24 hours, as of noon Korea time, over almost 433,000 new cases were reported, and that has brought the total to 221.9 million cases. And those are the updates I have for now, but I'll see you back after the government briefing. Sunny?
All right, so as always, thank you for now. Right, as part of efforts to spur private spending, the government is offering another round of stimulus payments to the public starting this week. For more on this, I have our Kim Sung-min here in the studio with me. Sung-min, welcome.
Good to be with you, Sunny.
Right, so do tell us who is eligible and how much is being given.
Sure, the new round of stimulus payments will cover 88% of the country's population, and each eligible resident will receive 250,000 Korean won, or around $215. Unlike last year when the payments were directed to households, financial aid will be provided individually this time around. The country's health insurance premiums, which are levied based on the individual's income and property ownership, have been used to determine who's eligible for the stimulus. For example, for a family of 2 with a single source of income, if they had paid a total premium of 200,000 Korean 1 or less, then both are eligible. In addition to Korean nationals, permanent residents and foreigners with a Korean spouse can also receive their checks as long as they're enrolled in state health insurance.
I see. So, is there a simple way to find out if you're eligible? And if you are, how can we apply?
You can go to the website of the National Health Insurance Service to find out if you're eligible and apply, or use a number of online banking apps. But there's an important thing to keep in mind. During the first week, you can only apply on certain days depending on your year of birth. For example, it's Tuesdays today, so registration is open for people who are born in a year ending with the numbers 2 and 7. The payment will be processed one day after the application is submitted. Recipients can choose to get the stimulus on their credit card or debit card, as a gift certificate, or as a prepaid card. Applications will run until October 29th, and you can spend your credit until December 31st. Places where you can spend your credit include traditional markets, grocery stores and restaurants, and also cafes and convenience stores. But they can't be spent at department stores, shopping malls, retail chains, and on delivery apps. You can and should go to the government website for the full list of businesses where your credit can be used.
I see. And Sungmin, what looks to be the potential impact of this latest round of relief funds on small businesses?
Sunny, when Korea handed out its first round of stimulus checks in May last year, businesses saw an 11% on-year boost in sales in the first month alone. According to the KDI, it also led to some $3.5 billion worth of credit and debit card spending. But many business owners say the stimulus checks are only a drop in the bucket compared to their plummeting revenues due to the country's tight social distancing curbs.
2019년도에 비해서
Sales plummeted 70% last year compared to 2019, and it plunged even further from that figure by 90% this year. I used to pull in around 2 or 3 million won a day, but now that's dropped to around 100,000 won. I may be eligible for stimulus checks, but it doesn't help. Everything will be fine if they just lift the restrictions on operating hours.
The most urgent thing is to let us operate, not just giving subsidies. I have to pay off the loan, but how can I pay it back? I need an operating profit to do so. But if I can't run a business, I don't have a chance to pay it back.
To alleviate such concerns, the government has eased social distancing rules starting this week, allowing businesses like restaurants and cafes to operate until 10 p.m. from the previous 9 p.m. But businesses say that's not enough. They're in fact planning to hold a nationwide vehicle rally tomorrow on Wednesday to voice their struggles. Some 3,000 vehicles are expected to gather. They have two requests: a complete lifting of the limit on operation hours and broader compensation for the losses incurred by businesses.
Right. Well, seeking a balance between protecting public health and ensuring economic activity remains a challenge for most countries. All right, Sungmin, thank you very much for the coverage.
Thank you.
Right, it is time now for the regular afternoon briefing on the pandemic situation here in Korea for this Tuesday. The briefing is about to start. We'll come back to you afterwards.
브리핑 설명이 있겠습니다.
네, 방대본 역학조사
I am Director Lee Sang-won of the Epidemiological Investigation Task Force, and let us now begin our regular briefing for September 7th, Tuesday. First of all, on the COVID-19 vaccination front, yesterday alone we have over 1.36 million people receiving their COVID-19 vaccine, and this is the highest daily inoculation number since we have rolled out the COVID-19 vaccination. And as of today, 10:30 a.m., we have a total of 60% of the population receiving at least one dose. And if we see over the population of aged over the age of 18, this is about 69% of the population. And as of today, we have more than 30.8 million people receiving their first dose of the COVID-19 vaccine, which is 60.1% of the total population. And among them, over 18.4 million have been fully fully vaccinated. And by age group, we have seen some proportion of the vaccinated. And as for the first dose, in the 60s, have about 93.6% the highest rate. And as for the fully vaccinated, we have about 83% for those who aged between the ages of 70s. And also in the people aged in their 50s, we have over 90 people receiving their first dose of the COVID-19 vaccine. And those between the ages of 18 and 49 are also receiving their COVID-19 vaccines. And we have began to roll out our second dose for those people in their 50s. And we believe that the fully vaccinated among this age bracket will also increase dramatically. And also we have had some 3 million inoculations in March, and also we are reaching 30 million in September, and we are speeding up with our inoculation. And as for the age group for 18 and 49, we are also giving out the COVID-19 vaccines and the surplus vaccines on a daily basis. We are also seeing a daily inoculation, and thus we believe that we can achieve our goal of the vaccination target of achieving over 70% of the population with their first dose by Chuseok. And as for the COVID-19 inoculation, post-inoculation adverse responses, as well as safety-related measures, we will make sure we are fully prepared. And as for the electronic QR code visitor log, we also have some efficiency analysis done. And the headquarters, we have carried out the QR code system, and we have seen how efficient and effective the system was in tracing down the patients. And we have provided the SMS messages for those who are exposed to the same venue. And in order to have efficient performance of such a system, we needed to have an overhaul in our scheme. And to this end, we have also shortened the time period to just 5 minutes to enable us to have access to the number of people who were at the same venue. And this was also shortened from the previous 0.05 days earlier. And as for the global outbreak, here in South Korea, when we consider the major indexes compared to other countries, we are seeing a very low proportion when it comes to infections and fatalities and so forth. And according to WHO, we have about 283 cases per every 1 million, which is very high in other countries. It's over 10,000 in Japan as well, and also over 3,000 in the US and so forth. And as for the COVID-19 measures at schools and for students, here are some measures. We have been expanding the in-person classes for many school students, including those in high school, middle school, as well as college and university. And we believe that the university students are also exposed to the virus, and we believe that they are aged between the ages of 19 and 24. And also this was followed by the middle and high school students aged between 13 and 18. And also the elementary school students also were in the lower list of when it comes to the risks of infection. And we have seen continuous increase in the number of student infections. However, lately we are seeing a slight decline in this number. And as for one cluster infection, we see that an average number of 16 people were infected, and among them, about 60% were related to academies, private academies, or school campuses. And also there were PC rooms as well as other private academies and also singing rooms, which also was the venue of the COVID-19 infection spread. And this was also seen as the virus spread from students as well as to other members of the family. However, and also for those aged between the ages of 16 and 18, as well as 19 and 20, we have been also analyzing the effectiveness of the COVID-19 vaccine. And as for the COVID-19 vaccines for those between the ages of 16 and 18, we see that the effectiveness was about 98% and about 92% for those between the ages of 19 and 20. Of course, we have a limited number of students who have been receiving the COVID-19 shots. However, we believe that these analyses prove to be significant. And as for the new variant cases, here are some details. For the last week, we have looked at about 22.6% of our infections, and we have seen a major variant accounting for about 97.3% of our rate, and the Delta variant was about 97% detection. And aside from Delta variant, for the past 1 week of September, we see that there was 1 imported cases and 2 local transmissions, and we have detected the Gamma variant as well. And next, we also have some updates on the breakthrough cases. Cumulative breakthrough cases now at a number of we have been looking at the fully vaccinated people of more than 9 million people, and about 3,500 people have been reported as breakthroughs, and we have the highest proportion coming from those in their 30s. And by vaccine types, the Janssen vaccines had the highest proportion, accounting for about 0.13%, and AstraZeneca followed by with the 0.42%, and also Pfizer by 0.02%, and Moderna with 0.008%. And as for the cross inoculation, we have a 0.0019%. And we have been looking at about 1,000 cases of the new variants, and we see that some 80% of them have been new conferred to be new variants. And this morning, we have concluded that 60% of the total population have received at least 1 dose. And we believe that we can achieve our target of 36 million people receiving their first dose before our Chuseok holiday. And this was all possible thanks to the medical professionals as well as the epidemiological investigators. And above all, we want to thank you as well as part of all of the rest of the public. And during today's briefing, I have mentioned this earlier. However, in our primary analysis, we have seen the effectiveness of the vaccine for students as well. And this is above 90% on average, and this is a very high rate. We believe that inoculation is very important to safeguard your health, but also those of others, including your loved ones and also people around you. It is the best and the strongest and the effective weapon that we have at hand right now against COVID-19. So we ask you to get your COVID-19 shots depending on your reservation schedule. And if you have not done so, please also do get your COVID-19 shots. And in your daily routines, please comply stringently with the COVID-19 restrictions, and also comply with our attendance gap as well as gathering cap.
Right, that was Lee Sang-won with Tuesday's afternoon briefing, and I have Soa here back at the desk with a summary of his address. Soa.
Yes, Sunny. So let's begin with some updates on the vaccination rates. I mentioned before that almost 60% of the nation's population has received at least 1 dose. But now the official says as of 10:30 a.m. we have surpassed that goal of, not goal, but 60%. 60.1% now have received their first shot as of 10:30 a.m. And that is equivalent to almost 70% of adults aged 18 and above here in the country, and over 93% of those aged 60 and above have received that first shot. He also mentioned that there has been a rise in student infections lately, and university students, so those aged 19 to 24 were on the top list, followed by middle to high school students, whereas there was a lower number of elementary students that have been recently infected. But he also mentioned that there's been some results on the effectiveness of COVID-19 vaccination for those younger people. And for those aged 16 to 18, the vaccines seem to be 98.4% effective. And for those aged 19 to 24, 92.4%. He did mention, though, that we do not have that many people already fully inoculated in that age group. So those numbers may not be very precise as of yet. And also some updates on the variant cases. Out of the genetic analysis that have been made in the recent week, 97.3% were found to be variants, and 97% is the number of Delta variants within those cases.
Right, so it is looking to become the predominant strain here in the country. All right, so thank you very much for that.
My pleasure.
Right, now just as our source mentioned, 60.1% of the population here has received one dose of the COVID-19 vaccine. And while public support of the inoculation campaign has been strong, a few remain hesitant, concerned about the possible side effects. Accordingly, in this next report, we weigh the potential risks of vaccine repercussions with the reported complications of COVID-19 infection. Do take a look.
Korea's inoculation campaign is picking up speed, but so are the unfounded rumors and misinformation about COVID-19 vaccines. One example is a belief among some people that the vaccines have led to more fatalities than the actual disease itself. This is, of course, categorically untrue, with the death toll from COVID-19 far outnumbering the number of post-inoculation deaths. This also holds true even when including all post-inoculation deaths, even those without a clearly established link to the vaccines. In addition, around 1.5% of all COVID-19 patients have developed serious illnesses, compared to the microscopic percentage of all vaccinated people who experience severe post-inoculation events.
이상 반응 중에서 97.8%는 근육통이나 두통과 같은 일반적인 이상 반응입니다. 2% 정도만 조금 중하다고 생각되는 이상 반응으로 그 빈도는 매우 낮기 때문에.
But no vaccine is perfect, and rare cases of blood clotting and myocarditis have been linked to the COVID-19 vaccine. Scientists are still investigating the possible link between viral vector vaccines like those from AstraZeneca and Janssen and blood clotting accompanied by low platelet counts. However, the chances of this occurring is extremely unlikely, with research in the UK showing that blood clotting disorders only occurred at a rate of 66 people out of 10 million AstraZeneca vaccine recipients.
If people do develop these side effects and they're picked up early, and this is part of the reason we want to communicate these results, so if people do develop bleeding or bruising after vaccines, it's really important that they do seek medical help. There are various treatments that we can institute so we can try and improve outcomes by intervening as a medical community.
Korea has lowered its age limit for AstraZeneca vaccines, allowing residents over the age of 30 to receive them.
지금 아스트라제네카 백신을 누적해서 한 1,200만 건 정도 맞은 상태에서 확진된 케이스가 3케이스이기 때문에요. 50대 미만 전체 인구 한 2,500만 명이 다 맞았다 하더라도 3명의 2배니까 6명 정도만 중증 혈전 부작용이 발생하는데 50대 미만의 코로나 감염으로 인한 사망자가 지금까지 한 40분 정도쯤 생겼거든요. 걸리는 게 차라리 안전하고 백신을 맞는 게 위험하다는 것은 통계적인 결과랑 백신의 효과를 보면은 절대로 생각할 수 없는 위험한 생각이실 것 같습니다.
In regards to myocarditis, which have been linked to mRNA vaccines, only 2 cases have been reported so far in Korea. When looking at Israel, the risk of developing myocarditis as a result of complications from COVID-19 was about 4 times higher than the chance of the same condition manifesting post-inoculation. Furthermore, many health experts say that most people who develop myocarditis following vaccination usually make a full recovery.
염증 치료와 더불어서 신부전 치료제인 전환효소 억제제라든가 베타 차단제 그리고 이뇨제와 같은 이런 약물 치료를 하게 되고요. 그런 경우도 대개는 1 내지 2주 치료 후에 안정화돼서 대부분 완치가 됩니다.
When doing your own research, be sure to refer to facts and information that are based on hard science rather than rumors before making your decision on whether to get vaccinated.
The drawn-out pandemic is continuing to limit outdoor activities, and it's led to more people in their 20s and 30s to drink alone at home. We have seen a 40% on-year spike in our wine sales this year.
Calls for isolation amid the pandemic have led to an alarming phenomenon, a tangible growth in substance abuse and smartphone addiction. For more, I have Dr. Won Eun-soo from Chaum Life Center. It's a pleasure to have you again, Dr. Won.
Thank you for having me.
And I also have Dr. David Kwak from Soonchunhyang University Hospital. Welcome back, Dr. Kwak.
Good afternoon.
Meanwhile, joining the session virtually is Dr. Abdel Aziz Shaheen at the University of Calgary. It's good to have you with us, Dr. Shaheen.
Thanks for having me, Fanny.
Right, Dr. Won, we'll start here then. Let's begin with your actual experience as a psychiatrist. Have you seen an increase in the number of patients suffering from addiction amid the pandemic?
Yes, definitely. Well, even according to recent statistics, those who actually had a previous addictive disorder, whether it would be substance-related disorders such as alcohol or non-substance-related disorders such as smartphone use, online games or gambling, all showed an increase of addictive behaviours as a way of coping with the stress and emotions related to the COVID-19. And an increase in both quantity and frequency of addictive behaviours were shown. And experts agree, based on research and their clinical experience, that the pandemic-related strains such as economic burdens or social isolation or general anxiety about the pandemic, they're all major drivers for this increase of addictive behaviours. And I've definitely seen an increase in alcohol consumption among my patients who seem to be extremely much more stressed and isolated during this pandemic compared to other times. And that's why they're making unhealthy choices to alleviate their stress, such as alcohol consumption. And although the level of stress has increased substantially, the majority have fewer ways to manage it because it's been those resilience-promoting activities such as outdoor activities and social interactions, they have been less safe and less accessible during this pandemic. And that's why they're turning to more alcohol consumption. And alcohol actually leads to exacerbation of sleep problems and depression and anxiety, so it's becoming a vicious cycle.
Right, it is. And before we proceed any further, Dr. Kwak, what is the medical definition of addiction?
So there's a book called DSM, and it's an abbreviation for Diagnostic and Statistical Manual of Mental Disorders. And all the medical doctors globally refer to this particular book when diagnosing or treating patients with either mental problems or psychological problems. It lists 11 different behaviors that you need to show in order to be considered as either addictive or showing patterns of addiction. And I'm just going to name a few. I'm not going to list all of them here, but namely taking any substance or behavior in larger amounts or longer than you're meant to, or wanting to cut down or stop using any substance but not managing to. Spending a lot of time getting or using, recovering from the use of substances, and craving and urges to use the substances, continuing to use even when it causes problems in relationships, giving up important social, occupational, and recreational activities because of substance uses, using substances again and again when it puts you in danger, and needing more of the substance to get the effect you want, basically called tolerance, and also development of withdrawal symptoms, which can be relieved by taking more of the substance. So these are just a few of the list that I just mentioned. If you count, let's say, 2 or 3 out of these, you're considered mildly showing disorders. If you're showing 4 to 5, then you're considered moderate. 6 or more, you would be considered fully addictive to any substance. There is also subcategory to this huge category called behavioral addiction, but which follows a similar pattern if you are to be addicted to a certain behavior, such as withdrawal symptoms and you wanting more and cravings and such. So formally, medically speaking, if you're showing some of these symptoms, you would be considered addictive to either a substance or a behavior.
I see. Meanwhile, Dr. Shaheen, I believe you led a study on the impact of the pandemic on alcohol consumption in the Canadian province of Alberta. Could you tell us a bit more about your findings?
Sure. So actually, similar to Korea, we noticed over the last year a significant increase in the alcohol sales across Canada, from British Columbia to Alberta, and even to the east, Quebec, and as well as Ontario. And the rise of alcohol sales went up from 18% in some provinces up to 45% during the first few months of the pandemic. And as I mentioned to one of my friends and colleagues here in Alberta, while I was standing in line up for grocery, I found there was a lineup for the liquor store is almost as long as the lineup for grocery line. So I was worried about that, and I told my colleagues we most probably have a problem in terms of admissions for alcohol-related liver disease. So we looked at different alcohol liver disease, mainly alcohol-related hepatitis and alcohol-related cirrhosis or end-stage liver disease. And for alcohol-related hepatitis, we already have a problem before the pandemic because those are the patients coming very sick. And we expected to find an increase. However, we were shocked by the results. So after the pandemic, from March, after the restrictions, I would say, from March 2020 to September 2020, over those 6 months, we found out 9% monthly increase, month after month, 9%. So the rate of hospitalization before the pandemic, we looked on the average rate in the 2 years before the pandemic, and the rate was around 11 hospitalization per 100,000 hospitalization. That rate doubled to 22 per 100,000. And you can imagine, Sunny, that the rate by doubling for this number of patients with alcohol-related hepatitis, that can tell us for alcohol-related liver disease or alcohol cirrhosis, we can find increasing number in the near future.
Right, that's a very frightening finding, Dr. Shaheen. Was there a discrepancy, doctor, between, for example, female patients and male patients with regard to liver disease triggered by alcohol consumption?
Thankfully, no. We didn't expect. We expected to find difference, especially there are reports showing that young women are at risk for alcohol consumption. However, what we surprised by seeing that the average rate went significantly lower than before. So the average rate for admissions for those people presenting with alcohol-related inflammation was around 48. Now it's around 43. Year old, as well as more mainly coming from rural areas. Usually those were coming from suburban or intercities. Now we are seeing this in rural areas, as well as they don't have comorbidities like compared before the pandemic. So those basically healthy young folks living in rural areas presenting with severe illness due to alcohol-related hepatitis.
I see. Meanwhile, Dr. Won, do you believe alcohol abuse is the most common form of addiction in the wake of the pandemic, or are there other types of addiction?
Well, definitely, I've seen my patients drink more alcohol, definitely, but also I think smartphone use was another big problem. Statistics have shown that smartphone usage has increased in all age groups. And it's not surprising because everyone was looking up current COVID-19 related information and social networking, and also doing entertainment applications through their smartphones. And although the smartphone technologies was crucial in fighting the COVID-19, it has exposed the general public greatly to a higher risk of problematic smartphone usage. And problematic smartphone usage is defined as excessive, addictive, inappropriate smartphone use, which is accompanied with mental and physical health issues, as well as social impairments in everyday living. And problematic smartphone use seems to have been exacerbated by the psychological distress the COVID-19 has been caused, as mental distress is actually an antecedent and also a consequence of addictive behaviors. Therefore, it should not be surprising that recent data is showing that there's a positive correlation between COVID-19 anxiety and problematic smartphone use severity. And also the younger generation seems to be more influenced in severity-wise than their older counterparts.
I see. And staying with smartphone addiction then, Dr. Watt, is there a way to perhaps ensure a healthy interaction with your smartphone?
Well, it's actually, there are self-preventive measures. So set time limits. I mean, set times where you're not supposed to use your smartphone, such as dinner time with the family. Or there are actually applications that help you cut down on your smartphone use. So there are self-preventive measures.
Right. Going back to alcohol addiction, Dr. Kwak, now drinking at home has become a trend of sorts amid the pandemic. Now, does this trend itself place an individual in danger of becoming addicted, do you think?
Well, I would think so. When I was going to medical school, the first thing that we learned as the first sign of possibly becoming addicted to alcohol was drinking by yourself. Sadly, through the pandemic, we're seeing a lot of those cases. I myself am not quite of a drinker, but I've seen a lot of my friends actually starting to drink themselves at home, possibly sharing with spouses, but if not, just completely alone. If I may start bringing on some words here. So there is a definition of binge drinking and heavy drinking, and those are the two things that we need to watch out for, which also happen to be very common in Korea. Binge drinking counts as 4 drinks per session or 5 drinks per session for females and males. Also, and heavy drinking counts as 8 drinks per week for females and 15 drinks per week for males. Meaning, if there is anybody who exceeds this amount either per session, which counts as 2 hours, or per week, they need to seriously think about maybe reducing the amount or consider themselves as possibly going into abusing of the alcoholic drinking and possibly watch themselves out for this. But also, in regards to the addiction behavioral changes, as I've mentioned already before, it follows a similar pattern. As you want more of it, or if you're hindered of your regular activity because of drinking, or if the drinking causes problem in your personal relationships, those are clear signs of alcohol addiction. And at that point, you might need to seek help from medical personnel as well.
Right. Dr. Shaheen, I also hear the surge in alcohol consumption has affected pandemic containment efforts in Canada. Could you elaborate this for us?
Yeah, we noticed with the beginning of the pandemic, especially with the restrictions and moving most of the care to be virtual care, and that limited access to the patients with substance use to harm reduction centers. That led to increase the burden of substance use and deaths related to substance use in Canada. In fact, in the first year of the pandemic, the deaths for patients or people who are under the age of 65, almost 3 times that compare, like 3 times more than the deaths related to COVID in relation to this age group. So for younger than 65-year-old patients who have substance use, around 5,500 died during the first year of the pandemic compared to 1,400 had COVID-19 infection. So the problem, we need to reach a balance between the social restrictions and patient access, as well as how to maintain the precautions for the pandemic. So I remember the first 6 months of the pandemic, people were afraid to come to the hospitals. People were scared from the pandemic. They didn't know what to expect. So that led to the rise in the mental health crisis and substance use, especially with fentanyl, as well as alcohol. And now we're trying to find the balance, especially with the 4th wave in Canada hitting hard. We need to find that balance in provide access to these patients in need with substance use, as well as maintaining the precautions and restrictions to control the spread of the virus.
Right, and it's a very difficult task, of course. Dr. Wan, an interesting finding here in the local front is that the frequency of drinking among women has been found to be greater than that of their male counterparts. How do you explain this finding?
Okay, well, there are several factors, and as I've mentioned, the heavier drinking is actually a way of coping with the stress and emotion related to COVID-19. And women were shown to experience more anxiety and depression during this pandemic because of a biological reason, because females are actually known to be more biologically prone to affective symptoms. And also environmental stresses as well, not only economic instability and social isolation, but also heavier responsibilities at home. Because, for instance, women were pressured into working at home and taking care of the kids at the same time, without the normal help of grandparents or the childcare facilities because of social distancing regulations. And also, it's further complicated by the barriers of females getting treatment for alcohol overuse, and which includes guilt and shame of being presented as a bad mum, and also lack of support in childcare, because they're actually having trouble coming into the hospital for treatment because they can't make the time, and also the treatment for the affordable of being able to afford treatment, and also family opposition, and also the lack of gender-specific treatment. They're all factors that actually work as barriers for females getting treatment for alcohol overuse.
Right. Now, Dr. Kwak, as Dr. Shaheen has pointed out, excessive drinking can lead to liver damage, of course. Now, having said that, is there a way to self-test, perhaps, the health of your liver?
Well, there will be some signs that show up once your liver starts failing, but I need to iterate here that if those signs start showing, it's already too late. So it's better for heavy drinkers, or if you are suspicious of maybe having an addiction over alcohol, it's better for you to actually go into hospital and be checked out by medical personnel. Some of the signs are including jaundice, that's having yellowish skin either on your eyes or your general skin, or showing swellings on your legs and arms, primarily due to accumulation of fluids in your abdomen, but also very general dyspepsia, meaning inability to digest foods as much as you did. But once again, I need to reiterate once again, if these signs show up, it might be already too late. So if you happen to be a heavy drinker, it's much better for you to actually go get in and seek medical help, or be checked out through blood or imaging, and make sure that you're safe to do so.
Right. Moving on, Dr. Shaheen, the pandemic has reportedly aggravated Canada's deadly opioid overdose epidemic. Could you tell us a bit more about this?
Yeah, in fact, Statistics Canada, which kind of like producing a really large study evaluating the burden of the substance use before the pandemic and during the first year of the pandemic, showed that around 3,700 patients died due to substance use in the first year of the pandemic. 3,700. And the worst year before the pandemic was 2017. And during that year was 3,200. So during the first year of the pandemic, we already exceeded the worst year in the last 10 years before the pandemic. So definitely there is increase in the mortality. And for the burden, as I mentioned earlier, the number of cases of substance use tripled from 5,500 patients had been died during the substance use in Canada during the first year. Only 1,400 we found dying due to COVID in the same age group. That tells us that the burden of substance use is 3 times more than the burden of COVID-19. We started to realize that in Canada now, and many efforts, especially in BC or Quebec and Ontario, as well as in Alberta here, we will try to identify people at risk. and we will try to reach out, and we will try to mobilize teams to help them out, because the burden is huge, as well as Dr. Quack mentioned for alcohol-related liver disease. Unfortunately, when the patient's presenting with severe inflammation, it is too late. And those patients stay in hospital for a long time, maybe 2 weeks. And unfortunately, there will be issues in terms of their care. Most of them need ICU admissions, and many die in hospital. Around 8 to 9% of these people die in hospital, and many people die after they leave the hospital. As well as it's very hard to provide liver transplant in a very short time if they need it. So it is so problematic socially, ethically, and the burden is huge on the patients, the families, as well as the physicians.
Right, so taking a proactive approach and making sure that prevention is there before the actual unfortunate case would be very important then. Right, Dr. Shaheen, thank you very much for your thoughts today. Dr. Wan here in the studio, thank you for being with us. And Dr. Quack, as always, thank you for being with us as well.
Thank you.
Right, well, essentially, it's a tale of two threats, if you will, amid the pandemic now, the virus and addiction. Do keep your distance from both. Thank you for watching.